watu kama sisi wenye tuko na mimba ndo tunaweza pata hiyo COVID-19 haraka.
Let me say this pregnancy is very tough, especially now that there's the pandemic. It's stressful and you have to take it.
Now when we divert all the oxygen to treat COVID, what happens to the infant who needs oxygen?
What are the side effects of getting this jab? And you're not only making a decision for yourself, you're doing it for the baby too.
Maternal health, this is the well-being of the mother during and after pregnancy. And child health is also the well-being of the baby while they are an infant up to adolescence. The well-being of the mother and the baby is important because in an aspect of mental, social, physical way. They're supposed to be, well in all those aspects.
Maternal health is about people choosing when to deliver children, choosing to go to clinics for antenatal care, choosing where to deliver, and all that. So there are a lot of things when you talk about maternal health. And the girl child education contributes a lot, income to families contributes a lot on how those decisions are made, empowerment of women, a woman just being able to make decisions about her sexuality. All those things matter. Issues around family planning do matter as well.
You need to have a functioning facility. You also need to have skilled care attendants. In skilled care attendants, you will need to have people who will sit down and take you through pregnancy, teach you about, give you health talks, teach you about birth plans, teach you about the danger signs in pregnancies that in case you see this while you're at home, you need to come to the facility and get assisted in such an area.
The health of women, mothers and children is a very fundamental and key area to invest and focus in. This reduces mortality rate, helping attain the Sustainable Development Goal by 2030, which is a very critical global health priority. The third Sustainable Development Goal aims to reduce global maternal mortality to less than 70 per 100,000 live births by 2030. Under the same goal, member countries, Kenya included, aim to reduce preventable deaths of newborns to at least 12 per 1,000 live births and children under 5 years of age to 25 per 1,000 live births.
This is measured by, for example, how many women unfortunately pass away during childbirth and such like things. How many get significant complications when delivering, how healthy are the children or babies when they are born. Are there any babies who pass away soon after birth?
We've seen reductions in maternal mortality. We've seen increase in uptake of family planning. We've seen increase in rates of safe delivery. Maternal morbidity has gone down quite dramatically. Even child mortality and infant mortality have been improving over the last many years.
In the last 10 to 15 years, Kenya has made great milestones in advancement of maternal and child health. However, there were already risks to these milestones. With COVID-19, these risks might have widened, therefore compromising Kenya's target for maternal and child health.
We were on a good trajectory. I think we've done very well compared even to our neighbors. But now when COVID came, I think everything has been disrupted. And at this point, the disruption is so much so that we don't even know what it is because we've not collected data very well. What we know is that things are not as before, and they are not better than before. They can only be worse.
In the wake of COVID-19, all efforts and energy were channeled to the pandemic, pushing other essential services like maternal and child health to the edge. COVID-19 then took a toll on maternal and child health, putting the lives of mothers and children at risk.
We've not said we will not spend money for maternal health on COVID. We will not spend resources, human resources that were meant to manage maternal and child health on COVID.
You found that a lot of hospitals had to create space or isolation wards for COVID patients, you found that a lot of staff had to be sort of diverted towards taking care of COVID patients.
And that reduced the number of clients who are visiting the facilities. And most of the clients even who are coming here to our facility, they were coming from other facilities where they will report that they were told they go this month to the facility for the ANC clinics, and then they skip like 2 months or 2 visits, then they go for the other.
Maternal and child health could be at a breaking point in this pandemic. As much as the rules to prevent the spread of COVID-19 are beneficial, in some cases, they compromised maternal and child health services. This is CFK's Tabitha Maternity Home under the Primary Healthcare Program. This facility is providing maternal and child healthcare services in Kibra. Through it, we understand the importance of maternal and child health, as well as the gaps in service delivery that came with the COVID-19 pandemic.
Take you through pregnancy, teach you about, give you health talks, teach you about birth plans, teach you about the danger signs in pregnancies.
Florence Mwaluda is a senior nurse here. She has provided services to mothers during this pandemic. With the help of other healthcare workers in this facility, her aim is to protect the lives of mothers and their children.
Above all, finances, we cannot say we need the money more than how we need to assist this mother. The mother and the baby comes first.
Deep breaths have proven to improve circulation of blood for pregnant women and their unborn babies. Nurse Florence tells me that with masks on, it becomes a challenge for pregnant women to breathe, especially when in labor.
A mother comes in labor. Yes, they were having, they had put their masks on, but now they have been admitted and they are in the labor room. Rarely you get a mother who is in labor having those deep breaths, putting their masks on. Yes, you will insist for them to put it on, but most of them, they need that air, breathing in and out, exchange of air. And if you are a nurse who does not put your mask on, you will definitely get affected. Remember, COVID is coming in a situation where some of us don't have those symptoms. So we will get clients who are breathing in and out, and we are learning now that COVID is being transmitted, it's like an airborne thing. So breathing in and out techniques, and this mother you're handling in labor up to delivery and even after delivery, that's when now they are comfortable putting their mask on when they have their baby, they are carrying their baby.
Now, service delivery has a great impact on maternal and child health. When the services are slow and poor, the health of the mother and child is compromised. And therefore, to provide quality maternal and child health services, the well-being of the healthcare worker is a key factor.
You will get maybe at one point you will be affected, or you will also get that COVID if they had it, but you will not know if you're getting it from clients. Remember, we also have families at home who are also, we come from work, go home, and mingle with our family members. So once you get this, your family is also affected. And once you go home being affected with work, you also mentally and socially, you are being affected with your family. You will be told now you have to self-isolate away from the family.
Let's take the example of oxygen. We use oxygen for many things in hospitals. We use it in theater to do cesarean section. We use it in maternity when children are born, babies are born and they are not breathing well, we give them the oxygen. Now when we divert all the oxygen to treat COVID, what happens to the infant who needs oxygen? What happens in theater where we need to do a cesarean section? Basically you don't have it, and so you can't do the cesarean, you can't resuscitate the dying baby because there is lack of oxygen. And that is an example of what's happening with all other services. When you think of doctors, if a district hospital or a county hospital has 10 doctors and you have the hospital is overrun by COVID cases, you take the doctors to manage the COVID. So what happens to the doctor who was treating in maternity ward? What happens to the one who was treating in the children's ward? They are taken away, and so those services suffer. So there is need, basically, I wish there was a way of fundraising separately for COVID and leaving resources that are there for the other medical services to be used for those other medical services. That has not happened as we talk now.
I'm trying to look at a situation where most of the nurses are away due to COVID. There will be shortage of staff, and also service delivery will be affected. Remember, now the nurses have to stretch, and once you're stretching, this means even the quality of care that you're giving to these clients is not as quality as it is required, because now you're trying to catch up, or you're trying to meet the needs of the clients, and you're tired and you're exhausted. Another thing will mean now, if people want to go for their offs to rest, they are not able to, because they have to cover those shifts that people are away due to the COVID. Another thing will be now, mentally, people will be affected. You will now start seeing nurses reacting, not because they want, but mentally they are not fit, because they are exhausted, they have fatigue, and they really need this rest, because rest is very important while working.
Immaculate Ochieng, a 24-year-old lactating mother from Kibra, is attending a postnatal clinic with a 2-month-old baby. She ensures that she takes all the COVID-19 precautions.
I have to have a mask. I have to wash my hands when I get there. My temperature has to be taken. If the waiting area is packed, I have to wait outside and have to wait my turn.
She shares her journey before giving birth.
You couldn't just enjoy being pregnant like people used to go walk around and everything. So you have to be careful, thinking, in case I get sick, what happens? Does my pregnancy get terminated? How do I cope with this coming from a slum area? The resources are really not there. Coming from this area, Kibra, is a blessing, and also it can be difficult considering COVID. We're living in the COVID times. It was extra challenging because now you see we don't have sewage lines around here, and keeping that level of hygiene that is required is not easy, because you have a lot of kids in a very small area. So it is not the same as someone who's living in Kilimani. This person has a gated place. Their place is self-contained, meaning they don't have to interact with somebody if they don't want to. For me, if I have to go to the shop, I'll have to interact with people. Somebody might have coughed, and while I'm passing, I touch this place. I have touched this contaminated place. I do not know this, because I do not know this who coughed or who might have not coughed. So, and if you're not careful, you've touched a surface, you come back home, you start eating, or you touch your face, and you just get COVID just like that. Now, contact tracing becomes difficult, because you don't know where or how you got it. Because if I have to go to the toilet, I don't have a toilet in my house, I have to walk to a toilet. I interact with people, others who don't even care about wearing a mask. They don't even care about hygiene. Much as I might be taking care of myself, I might still get it because somebody else is not playing their part. So coming from Kibra with COVID was very, very difficult. I remember there was even a time we were almost being put on a lockdown as people from Kibra because of the spiking numbers of infection that we had here.
Statistics have shown that maternal mortality ratio in the slum population is high, with COVID-19, pregnant women, lactating mothers and their children living in slums are at high risk.
So it's stressful, and you have to take it, because now you're not only thinking about yourself, you're also thinking about the baby inside of you.
The Kenyan government, through the Ministry of Health, is working to ensure that everyone is vaccinated against COVID-19. However, the special group of pregnant women and lactating mothers seems to be in a dilemma regarding the vaccine.
So they haven't given us enough information to know, is it safe for me while pregnant to go and get this jab? Or is it safe once I have delivered to go and get this jab? And if I get this jab, what are the side effects of getting this jab? Will it affect my milk supply? Because as a lactating mom, all you ever think about is, I shouldn't be stressed, because stress will lower my milk supply. Milk supply means baby cries non-stop. So the government is not doing enough civic education to let us mothers, or those who are already moms or first-time moms and lactating moms, know how safe is it for us to get this jab, if it's safe enough, or if there are still gray areas about getting this jab. So I feel, unless you do a research on your own, like go to WHO's site, read about what they have to say about the jab, you're literally in the dark. We are literally in the dark.
On the other side of town, I meet Simfros Okinda, almost 6 months pregnant, and she's here at Jacaranda Maternity for her antenatal clinic. This is her second-born baby. When I ask her to compare the experience between the two pregnancies, she says this has been tough.
Let me say this pregnancy is very tough, especially now that there's the pandemic. It's hard because, one, we do not have enough information on how you are supposed to take care of yourself. We just try the distance, mask, and you can't prevent yourself from moving around, because also you need to be able to prepare for the baby financially. So it's been tough, and sometimes you don't want to move.
Just like Immaculate, she doesn't have enough information about the COVID-19 vaccine. She says it's uncertain since she's not only making the decision for herself, but her baby too.
So you're not sure what right decision to make. And you're not only making a decision for yourself, you're doing it for the baby too. So, and most hospitals, even when you go to the clinic, they'll tell you it's a personal choice. So you do not know how it borders or what you're supposed to do exactly. If it is a personal choice, do I have enough information so that I may know the kind of choice that I'm taking for the baby? Because then again, I don't think I've gone to a clinic where I've been told the only option is to take the vaccine or don't take the vaccine. Actually, I think most hospitals just avoid talking about it, because maybe our Turkey, the results, they don't want you to blame them if anything happens. So we are living in very uncertain times, and as for me, I think I've been living by the grace because I can't say I've made the best decision, because I do not know what the best decision is all about.
The lack of information on the vaccine could definitely be putting to risk the lives of mothers and children as they are prone to COVID-19 infections.
It is proven that antibodies developed by the mother can pass down to the unborn baby, so that when the baby is born, that should they contract COVID, and there's no reason to believe that that can't take place, that baby will be able to survive and do well because they have developed the antibodies necessary to counteract COVID. So they may have COVID, but they'll be able to survive through it. And that's very important.
The vaccine protects against infection, and the vaccine protects against severe disease. Mm-hmm. We've seen now variants like Delta, where some vaccinated people still get infected. But we've not seen increase in deaths or severe disease. Mm-hmm. So for most of the cases, the vaccine will protect them from getting severe disease. It will protect them from dying. That applies across the board, whether they're infants or adults.
The gap about vaccine information is said to have been brought about by the initial information that pregnant and lactating mothers were not among those that were supposed to be vaccinated.
Because it was never tested on a pregnant woman, there was that initial hesitancy. Should we give it to pregnant women? We don't know what will happen if you give it to them. What about the unborn child? But slowly and surely, pregnant women, especially those in healthcare, decided, let us take this vaccine. So they were, quote unquote, the guinea pigs, isn't it? So a few of them took the vaccine, even if it had not been tested on pregnant women before. because they looked at the situation and said, I am pregnant, I work probably in the healthcare sector, I'm being exposed to COVID, I know that COVID in pregnancy is already high risk. So I'm already at a high risk. I can take my chances with the vaccine. So gradually a few, the brave ones, started taking the vaccine. They were observed. And from the observation of those who took the vaccine, we noticed there was no increased risk of them having the vaccine, both in pregnancy and also soon after delivery, during lactation when they are breastfeeding.
We have not been able to counter the misinformation and the myths and the safety issues. We've concentrated a lot on advocating for people to give us vaccines. I think now it is time to change that narrative.
Now, COVID-19 restrictions such as curfews have an impact on maternal and child health. Accessing health facilities for women and mothers in need of maternal services was a struggle. Imagine a pregnant woman in need of medical attention in the middle of the night, or worse, laboring at night. The situation for pregnant women in Kibra slums was worse. However, the society and caregivers had to find a way to avoid home deliveries for the safety of both the mother and child.
For us as a facility, we sat down and decided any client who comes during that curfew time, whether they are in labor or not, we will give them, somewhere to sleep until the next day. If they are not in labor, the next morning they can go home safe. If they're in labor, we continue with them with the journey during delivery. But for the relatives, we usually write for them notes. We were writing for them notes and signing and putting a stamp. But people here in the community are very tough because they come as a group. They come, a lot of them, so I feel like no one will do. Hakuna mtu angewasumbua kwa barabara. Wanakuja kikundi, neighbors, wanaume wambeba panga nini, just for security purposes for them. And tunaandika tu majina zao chini wote. We explain these are people who brought this mother to the facility. Can you allow them to go back home? But for the clients, we never released any client during that curfew to go home, because this is a mother who is pregnant. There's a baby inside her, so we're trying to protect her and the baby.
According to Savan Shah, his facility had to partner with a taxi company to bring in any pregnant woman who was seeking health services past the curfew hours,
in order to ensure that our patients can come to the facility and deliver without going through the anxiety of having to drive themselves and wondering whether they're going to be stopped by any askaris in town. So that's something that we put in place very, very early on.
We can only imagine how the situation would have been if facilities such as Jacaranda and Tabitha Maternity did not think outside the box. With COVID-19, the public was cautioned against gatherings in public places. Pregnant and lactating mothers being at risk, they avoided such places completely. To some, this meant avoiding health facilities for fear of contracting COVID-19. However, it also meant putting their lives at risk.
We'll get a lot of defaulters in our child welfare clinics, and even for pregnant mothers who are supposed to be coming for their clinics every month. For the maternity services, a lot of people lost their jobs. The spouses were out of work, so you will feel like the charges that we give, or the charges that we usually get for the package of maternity, they were not able to get that finance. So that will make them maybe go back to the old ways where they would now do home deliveries. Some of the things we did is we started our defaulter tracing, where we created we sat as a team and discussed, and we saw through defaulter tracing we will be able to also get information as to why these clients are not coming to the facility. And yes, some of them were coming, and some of them at least understood why there is need to come to the clinic for these services.
These women, of course, were scared to come to hospital, understandably so. So the numbers have gone down. Although with social distancing, with proper protocols, we have isolation departments in most facilities. We still encourage pregnant women to definitely come for their antenatal care.
The full lockdown could result in something as dramatic as mothers not being able to make their way to a hospital facility and delivering at home. And it is a proven concept that if you are going to have a pregnancy at home, you're going to have way more risks, particularly if that pregnancy at that point in time complicates. There are so many risks, so many challenges with a home-based delivery. You are way better off delivering at a facility. So that could be as dramatic as that.
According to Simfros, she becomes anxious when she thinks of going to the hospital for her usual clinics.
There's a lot of anxiety, especially when you have to go to a crowded place, when you have to go to the hospital, and then it becomes so hard to be able to stay safe all through, because we use matatus. I go to the market, you come to the hospital, people are sick, so I think just living one step at a time. Yeah.
Being a lactating mom and having a baby who is younger, like below 6 months, I wouldn't risk leaving the house each and every time, because if you go to the hospital, you're risking coming into contact with people. My baby is still small. I can't put a mask on her. So somebody might cough near me and these droplets of his or her saliva get to my baby, because right now people are very reluctant about wearing a mask. People don't really believe COVID is real unless they see it happening to somebody else. So a lot of people don't really wear masks unless they are forced to wear it, like when coming to a facility like this one, or going to an office where there is a security guard there who insists you have to wear a mask. If not, you're not allowed in.
At the gate, as is mandatory, there's a need for a temperature check, and hand washing stations were put in place to ensure that, at least on the respiratory and hand hygiene, that all the patients that were walking in were feeling protected.
After her antenatal clinic, Simfros is here today for an ultrasound. Despite the anxiety and fear, she has to look after herself and her baby.
This is one leg and this is the other leg, so look in between them.
It is said that you can never understand life until it grows inside you, and the joy of a mother is to be told that the baby they are carrying is well and healthy.
It's a beautiful experience, and it's not obvious that when you're carrying a pregnancy, then it is a normal one, the baby is okay. So I'm happy to hear that so far my baby is doing well, she's okay, and it's a she, by the way. And just hearing the heartbeat, kujua there's a human being who is doing well, breathing okay. I'm just happy as a mom.
Both from nutrition, exercise, well-being, mental and physical, so that you are setting yourself up for success when it comes to that beautiful day where you're going to be delivering your baby. You know, everybody wants and hopes and prays for it to be an exceptional journey and with a fantastic ending, and we want that more than anybody else. So we just want to share with that by encouraging people to start their journey as early as possible. You know you're pregnant, start your journey, go for a visit, go for a prenatal checkup. It's very important.
With the COVID-19 pandemic came an increase in teenage pregnancy, yet another threat to maternal and child health. Purity Okinda, a 19-year-old, is 8 months pregnant. She sat for her Form 4 exams not knowing she was pregnant. With all the signs that comes with pregnancy, she thought she had pneumonia.
Siku nilikuwa namaliza mtihani, hiyo siku nilitapikanga. Sasa hiyo kutapika ikazidi. Nikaenda usiku kupimwa. Nikapatikana niko na mimba kama nishamaliza mtihani, lakini nilishtuka sikuamini. Nikaenda nikaambia baba mtoto niko na mimba. Kaniambia tu nisitoe, nikae nayo.
Purity, representing other teenage mothers, did not start her antenatal clinics at the right time. As soon as you're pregnant, one is advised to start the antenatal clinics to check that her and the baby are healthy and doing well.
That's where we tell them of the danger signs, including bleeding, because you're not supposed to see any bleeding during pregnancy. If you see any spotting, you report to the facility. Fetal movement, a mother always listens or feels the fetal movements of the baby. So once you feel they are reduced or they are not there at all, you have to report to the facility. When the water breaks, that is into a drainage of liquor or even rupture of membranes, you will see a mother who will stay even at home for a week. They are just draining because they do not know. But when they come to these antenatal visits, usually you give them these health talks and you teach them.
Venye nilijua niko na mimba, huyo daktari akaniambia niende nianze clinic. Nikaenda hapo kwa hiyo bench ya clinic, nikasimama, kitu tu ikanisimamisha. Nikatoka tu hapo nikicheka, yani hata siamini.
Because they fall pregnant at such a tender age, they also, many of them are scared to seek healthcare. Many of them try and hide the pregnancy, and some are successful to hide it for a very long time, almost up to the point of delivery. Some even up to the point of delivery.
According to Dr. Momanyi, the increase in teenage pregnancy could mean an increase in fistula cases in the near future. Many teenage mothers did not know the importance of the antenatal clinics, and some even went for delivery without attending any clinics.
You find that when you are not followed up antenatally, you tend to have a higher risk of delivery complications. Because there could have been interventions done before you get to labor, which you've not had. So with this increased risk of delivery complications, we also have an increased risk of, for example, trauma during delivery. That is now what will cause the fistula, which is now that abnormal communication from the urine to pass the wrong side, right? And come out through the vagina, which is not supposed to do, right? So there's definitely a risk. First of all, they are young girls, they have not fully developed. So even their passages have not fully developed. And combined with inadequate health care, the risk just goes up. So it is very conceivable that fistula rates might go up, as well as other complications.
According to the COVID-19 statistics of daily infections in Kenya by the Ministry of Health, in the month of September, an infant was part of the statistics, with the youngest being an 11-day-old infant.
What's worse is you could end up having a delivery of a perfectly normal baby who unfortunately contracts COVID and passes away.
These numbers indicate a threat to maternal and child health. A lot can be done to avoid a spike in infant COVID-19 cases.
You know, pregnancy is delicate. And anytime you're supposed to be in a position where you can be able to reach a doctor or a health center, but because of the curfews, because of the financial constraints, you always having challenges. So just like I said, you live just one step at a time, but it's a very, very tricky time to have a baby. But we're just optimistic that eventually everything will be well.
COVID has really taken over. And they've forgotten, like, we need to ensure zero maternal, zero neonatal, the emphasis that was there before because of this COVID. And I'm hoping that soon they will come back, you know, and try to explain to us or try to bring out on how to manage these mothers, and also, you know, try to encourage us to how to manage them, because I feel like, especially with the maternal part, I'm not hearing a lot about it.
There's a lot of myths and misconceptions going around that the government needs to offset. They should have like a seminar where us lactating moms or representatives of moms can sit down and explain to us what to expect once we've taken this jab, or if it's even safe for us to take this jab.
It's all a matter of the total capacity. So the total capacity, if it increases, there is space both to prepare for COVID and also to maintain or improve health care for all other conditions. So going forward, I think that balance is what we are trying to achieve. If we all combine our forces together, we should be able to adequately take care of both COVID patients as well as any other medical conditions that require healthcare in facilities.
So Ida, in healthcare in particular, burnout is a big problem for healthcare workers. And to ensure that mental well-being and just feeling of safety is put in place for healthcare workers, you are indirectly, actually I would say directly, giving back to ensure that patients' outcomes are as positive as possible. It means that from a delivery perspective, there's a well-managed care that takes place, and from a neonatal perspective, it means that the baby that's delivered is also looked after.
Be the reasonable person in a world where people are unreasonable. And Kenya people are very unreasonable. You've seen them going to political rallies without masks. They are all crowding in funerals, in churches, without following protocols. The world is very unreasonable in Kenya. But if we get a few reasonable people, you will protect so many lives. And so that responsibility lies with me and you.
Now, we do not know how long the COVID-19 pandemic will last, but what we know is that there will be life after the COVID-19 pandemic. And therefore, as the world and Kenya in particular tries to flatten the COVID-19 curve, we should be careful not to have an emergency in maternal and child health. And we can do this by having a balance in resource sharing and provision of the much needed information, and definitely playing our role as citizens.